In this evening's edition of the Health Report, a call for parents and guardians to ensure children continue to practice COVID-19 measures. Shamala Pullen has a story.
Children of all ages have contracted COVID-19, but most children who are infected don't become as sick as adults, and some might not even show any symptoms. And with that, Health Minister Dr. Christopher Tufton says adults must be careful, especially those who fall into high-risk groups, as children can pass the virus to them without knowing.
We have had cases in Jamaica, even with our success, where a parent picked up COVID from her child and she died. And so it is very possible. But what that means for you is that your job is that much more difficult. Because while you know that the child or the children are relatively safe, the truth is you have to protect the older ones who are at home.
Dr. Andrea Garbott is a pediatrician and developmental specialist who is also the president of the Pediatric Association of Jamaica. Dr. Garbott says although some children may not be severely affected if they get the virus, parents and guardians should remain vigilant to ensure their safety. In fact, Dr. Garbott is reminding that children also run the risk of serious complications if they have an underlying medical condition such as asthma.
So there's always concern whether there was a death or not, or whether there was anybody ever being diagnosed. There's always been concern because even though the past literature had stated that children weren't being affected to the extent of adults, we do know that they do get infections. And for many times, initially what was being said is that they may be asymptomatic. So there has always been concern, hence school closures, having them physically distanced as well. So that has always been there.
Dr. Garbott is therefore encouraging parents and guardians to continue to monitor their child or children, to practice good personal hygiene to reduce the risk of getting the virus.
Hand washing, however, can become a game. We wash before we eat, we wash in the next 2 hours, we wash whenever we're going out. The best part is that when you say don't put your hands to your face, that's exactly when you want to put your hands to your face. So it's for the parent to be the one who's vigilant, to keep looking and recognize that, okay, now we need to go wash our hands. Visible dirt should not be there at this point in time, the frequency with which we're washing our hands. But it's now the parent's role to be there, to be able to supervise. And if it's not even the parent, a grandparent or an adult relative in the home.
With your health report, I'm Shamala Pullen wishing you good health.